Hi everyone, this is Ron and Dr. O'Sullivan here. We're going to do a limited series for you guys to the end of May, every Thursday at 9 a.m. and we're going to pick a new topic to talk about. We do invite everyone, if you want to have a question answered on one of our segments, please submit your questions to Dr. O'Sullivan, so Dr. O'Sullivan, at barkavpet.com, and we'll post that in the comments for you in case you didn't quite get that. And then hopefully one of your questions might be answered on one of our segments, which will be great. So I want to introduce Dr. O'Sullivan to you. So Dr. Sullivan got her veterinary degree from Purdue Vet Medical School and also spent time training in exotics in Tasmania, which is awesome. She continued her training in alternative medicine with an International Veterinary Acupuncture Society and added traditional Chinese medicine to her services. Dr. O has become a fear-free certified practitioner, which we've got her certificate here and we posted it for you guys on Facebook already. Okay. Just this year she got her certificate. In fact, we've made it such an important part of our business that we've asked everyone in our company to get certified as a fear-free veterinary professional. Thanks to Dr. O for that initiative. So she had a practice in Prescott Valley before joining Bark Avenue, where she provided integrative medicine approach for her patients' long-term well-being. Her services included both Western and traditional Chinese medicine examinations, acupuncture, holistic pet nutrition, herbal supplements, exercise and wellness, lab testing, some Western medical treatments, rehabilitation, pain management, homeopathy, massage, weight management, pH stabilization, grief counseling, spinal manipulation, constitution and breed consultations, senior wellness planning, and an extensive referral network. Wow.
We're busy,
So
yeah.
Dr. O uses both traditional Chinese medicine and Western diagnostics to develop personalized treatment and long-term care plans for each patient. So I welcome Dr. O.
Hello everybody, it's Dr. O, and I know the email is Dr. O'Sullivan at barkavpet.com, but most people call me Dr. O and have for a long time. And I wanted to explain to everybody what holistic medicine and integrated medicine is here at Bark Avenue Pet at this point in time. A lot of people think that holistic medicine is the exclusion of Western medicine from diagnostics and treatment, and a lot of times I get weird feedback from that. I just need everyone to know that the way I practice is integrated of every single resource that I have at my disposal, and with all of the extra information and education and meeting some really amazing people on my explorations. Like we use things like Dr. Dodd's to access, I believe, our NutriScans, our Cell Bio. I believe in things like MDR testing for our very specific breeds, our multiple drug resistance and very specific breeds, and it's important that everybody knows that, so that if we have our drug resistant breeds such as our Australians and our Sighthounds, we can ask questions so we know how to best take care of our animals long term. As Ron was saying, I got extensive education in traditional Chinese medicine with the International Veterinary Acupuncture Society, which was an amazing exploration into learning veterinary medicine again in Pinyin. I mean, like, again, it was intimidating, to be perfectly frank with you, but learning how to identify constitutions, learning how to use those constitutions to identify potential organ deficiencies or failures, or how those organs work together, and how we can best identify things preemptively. It's been the mystery, one of the Chinese medicine mysteries, in slowing down, doing extremely extensive observational physical examinations, and identifying constitution types, discussing these with the owners, which is a long conversation. Chinese medicine and integrative medicine is, I always tell people, it's a process, it's not a pill. So it's not going to be one appointment, it's not going to be one email, it's not going to be one conversation. And Chinese medicine and integrated medicine is like peeling an onion, right? So as soon as we find a primary concern, a primary constitutional issue, a primary treatment or direction to go, many times that peels away the outer layer. And what happens? We have another thing that we need to deal with, which is great because a lot of times we don't find those things until far down the road. I found that when we try to respect chi, which is energy, right? It's a life force. And the only way we can do that is fresh air, sunshine, creativity, and some of the things that we don't spend a lot of time doing. So fresh air, lots of exercise, right? We got to get out there, both ourselves and our pets, our patients. Nutrition. So nutrition is a huge controversy at this point in time, not only with things like our hearts because of taurine deficiency concerns, our genetic modification and organics, most recently with humans getting non-Hodgkin's lymphoma and connections there, and try to extrapolate that to the animal diet, and a lot of organic foods coming online and a lot of people interested in those things. So being able to find answers that aren't Dr. Google, sometimes that has value for people. So that's nice. Doing things with herbal medicine, that is an educational exploration on its own. Because herbals are wonderful. Herbals do amazing things with regard to all constitution types, problems that are identified using Chinese medicine, and a very, very long road of education and references. You have to have a master herbalist to talk to, just like we talk to Dr. Dodds, we talk to Standard Process, we talk to these people that only do these expert things, and we make them very case specific. When we do things with herbals, you have to know what you're doing, and you have to know how to integrate it into the Western medicine, the Western modality of medications, and like I said, a really thorough traditional Chinese constitution-based diagnosis, and they do work. They work over time, but once again, it's a process, not a pill. In traditional Chinese medicine, and we have to talk to people about, we want to have realistic expectations of time and results, and we try to stop adding to the problems as we try to address the current problems. Many times we use Western medications, Western processes to help animals feel better right now. And then we use Chinese medicine to make sure that it doesn't happen again, or make sure that we don't have related problems down the road. Helping to stop the problem right now, whether that's food, whether that's medication, whether that's surgery, whether that's other diagnostics, of course we use those. Of course we use those because we want to know how to make these guys, all of our patients, better today or tomorrow. I do have kind of a mandated rule. I think some of the people that work with me think it's silly sometimes, but my rules are eating, drinking, pooping, peeing, happy, and pain-free. Those are my goals for the treatment, regardless of what animal it is, what the issue is, or how long it's been going on. I want them to feel better tomorrow. Whatever it takes within the scope of medicine, traditional Chinese medicine and Western, eating, drinking, pooping, peeing, happy, and pain-free. That's my goal. So we have to have a lot of owner involvement, owner compliance to some degree, and a ton of owner education. So it takes a long time, and we have to develop a relationship, and our patients have to be the primary focus. Lifestyle changes for sure, lots of food changes, lots of supplements. Oh my gosh, supplements. And the goal of getting these guys on supplementation, getting them on herbals, getting them on food, getting them on exercise, is to eventually get them off. I want to get them off. I want to have a mandate that says demand less. We want less medication, less supplementation, less food garbage, less food manipulation. I'm a big fan of I love whole grain bread organic whole grain breads for my dogs. They eat fruits and veggies with me every single day. They eat organic free range eggs. I just hand it to them and they bite into it, whether it's raw or hard boiled, depending on what we're doing that day. But it's food. So how do we do that? We decide what's food, what's not food. And unfortunately, in the veterinary community, we've been teaching our clients that if it's not in a bag with a label on it, then it's not food, or it's not safe, or dogs and cats shouldn't have human foods. Traditional Chinese medicine and holistic medicine does not comply with that at all. And I think that scares some people sometimes. So it's more information, more education. So Homeopathics. Homeopathics are like treats light, and it actually is such a minute form of a toxin or other product. It's actually so dilute, it's actually beyond Avogadro's number, which means we can't detect it. We actually can't detect it, but we give it to our animals to try to treat issues that they have in a non-toxic way because it's so dilute. And I'll be darned if it doesn't work sometimes. I mean, it really does, and you can use it in combination with our herbals, with our food, with our Western medications, with our acupuncture, with our lasers, with our chiropractic, with our rehabilitation for weight loss or strength training, whatever it is we want to do, we make a plan for each individual creature. So it's, like I said, it's long, it's involved, and I love it. I love what I do, and it does work. You have to get these animals sometimes where they actually says, oh my gosh, they haven't done that in years, or they haven't been comfortable doing that for weeks, or I've never seen them eat that before. And to get those moments, yeah, that's what it's all about. So we're trying to integrate that into Bark Avenue, and now that Fear Free's on board, I'm double excited about what we're doing because of the stress, the fear, the anxiety that these animals will be going through at this hospital, hopefully minimized, in addition to try to identify our constitutions and develop plans for our creatures. And I guess I just hope you guys who are listening have questions, and feel free to send them to my email, and I'll be glad to answer them to the best of my ability. And hopefully we'll see you here at Bark Avenue soon. So let me know how I can be helpful, and see if Ron's got something to say here.
Yeah, what we want to do is really answer the questions that you have. You know, times like this where we have less client interaction face to face, we want to put this on and answer the questions that, you know, in a virtual face to face, so that we can give you that personalized touch and give you the information that you need and crave and want to know in this setting. And that's why we've chose to go through May, and depending on how well this goes, maybe we'll do some more. But I'd love to hear what questions you have. Even if they're about your own pet, we may not be able to diagnose, prescribe, or
Diagnose, treat, prevent,
prognose
cure. Yeah.
over virtual means like this. But we can certainly answer these questions in a broad stroke manner about, you know, how we've dealt with these similar cases in the past, or what we've done and seen improvement with, and love to answer those questions that you may have. If there's something you want to let us know, or questions about a particular product, we can try and answer those the best we can. If you want more specifics, we're happy to set up an appointment with you at Dr. O'Sullivan at our facility here at Bark Avenue. You can do that by calling our phone number, which is 480-807-5524. That gets you directly to the animal hospital here. We have a link off our website, which I've now posted in the comment section, that you can book your appointment online and never have to pick up the phone. It'll request an appointment with us. We've got many means of communication. We are now offering telemedicine for our current established clientele, so we can do some virtual meetings if that works better for you, especially with the Fear Free certification. You know, helping your pet transition from a very fearful situation back into our clinic, so they're not as fearful, or they don't have to have that muzzle on that we all hate to put on. Not only do you hate to put it on, we hate to put it on. So that's something that we need your input and help to get that done. So yeah, feel free to ask us whatever questions you may have, and if we don't have the specific answer, we'll get to you the best we can. Otherwise, we'll see you at our hospital for an appointment.
One last thing to say with regard to holistic medicine and integrated medicine. Holistic medicine is not an all or nothing proposal. Some people, when they call, they feel like, I don't want to tell my veterinarian I'm coming to see you, or I don't want to betray my normal veterinarian, or I don't want to, and all those concerns, they're realistic, and we do not violate those whatsoever. I love working with other veterinarians. We have really amazing networks with all the referring or accidental veterinarians. So having an open line of communication and explanation, and working together with other veterinarians or other referral hospitals or other animals in the house or other humans in the house for environmental changes, those types of things. It's about working together with everybody. It's not exclusionary at all. And especially if we have methods that are working for our patients that are not coming from me or coming from Bark Avenue, but they work, heck yeah, we're going to keep those. We're going to make phone calls. We're going to work together. We're going to do the things that clients need us to do in order to make these the relationships work, because everyone's got different needs, different expectations, and different concerns for their creatures, and we have to make sure we listen to these, because owners are always right. Sometimes in veterinary medicine, it's hard sometimes for veterinarians to swallow that, but if we stop and we listen to veterinary concerns, and we let those come out and come to fruition while we're paying attention to the patients, owners are always right. They live with these guys, and we have to find what it is that the owner's concerns are based on. And if we have other people that are in the mix with the care of this animal, we have to respect that. And even if it's another veterinarian, and I'm a big fan of being thorough, and I love testing, I love rechecking, I love doing referrals, and all working together to make sure that these animals get the best care possible to ultimately achieve the eating, drinking, pooping, peeing, happy, and pain-free lifestyle, which turns out it's quite a bit like fear-free. I was doing this before I even went to fear-free. I'm like, wow, what a great fit this is. So anything that we can do to make sure that all interested parties for the care of our patients are engaged, this is what we want to do for integrated holistic medicine here. So don't be concerned about asking any questions. Oh yeah, and there are no silly questions. There are no stupid questions. They're just not, because we don't know who you're talking about. We don't know the concerns you have. So we'll do the best we can to be as integrated and holistic as possible and take care of your loved one. Thank you.
Thanks, guys. We'll see you next week. We hope to have a nice hour-long segment if we've got enough questions, or if we have some really awesome cases to go over.
Yeah.
So again, send us your questions, Dr. O'Sullivan at barkatpet.com. You can message us, you can text us, you can call us if you don't feel like using email. Whatever it is, we'll get that information all together, and hopefully next Thursday at 9 a.m. we'll answer some of your questions. If not, we do have some exciting topics to cover. About traditional Chinese medicine. We've got some topics to cover, a little bit about what Dr. O'Sullivan said about MDR1 genes. What does that mean? What breeds are covered? What do I need to know?
Yeah.
Those are certain things that we want to talk about, so we're going to include.
And what does
those.
it even mean? Like, what does it even mean, right?
Exactly.
And what breeds? So just like
too many letters.
They're all acronyms, right?
Yeah.
So no, you're completely right. And any topics that people have specific concerns, and trying to do case studies that we've come across, fine. Anything that you have, sometimes we might be limited, like Ron was saying, no diagnose, treat, prevent, or cure, but information that might be helpful. And some of the, I guess they're products or testing or information that some people might not have, especially on food, on MDRs, on the cell bio that's coming up, the NutriScan, some of these things that might help people feel more in touch with how they can be helpful for their animals. So
let's see, we got some questions. Well, Cindy, come to Arizona and we're happy to see your pet.
The Brants, they're wonderful people. They have been down here, so that's great. And good communication, you guys. Hope to see you again soon.
Of May, and we hope to bring that further depending on the demand and how much questions you guys have. So feel free to bring it on, because we're going to give it to you. So good luck, and we will see you next Thursday, 9 a.m. Again, that email address is drosullivan at barkatpet.com. And we look forward to seeing you guys next week and bringing you a ton more information.
Thank you,
Thanks
guys.
again.
Have a good week.
You too.
Stay safe and healthy.